Hi, I'm Ashton, and I did my project on cysticercosis. First, let's meet Kevin. He recently took a trip to South Africa where he visited several underdeveloped villages that had no plumbing or proper bathrooms. He also enjoyed some of the local cuisine, which often included pork. 2 months later, he's back home and he's feeling sick, dizzy, confused, and has awful headaches. So he decides to go to the doctor. And the doctor tells him he's suffering from cysticercosis. Let's follow Kevin through his journey. First, we need to understand what is cysticercosis. So it's a parasitic tissue infection caused by a larval cyst of T. solium tapeworm. But to understand this, we first need to understand this. This is an intestinal tapeworm. It's only found in the intestines and is caused by eating baby tapeworms in undercooked meat. These tapeworms have segments that carry eggs, and when these eggs are ingested, they cause a separate disease called cysticercosis. It's caused by 3 different parasites, but we're going to focus solely on T. solium because this is the most problematic in humans, and the other 2 do not cause cysticercosis. So it's important to understand that cysticercosis is not tapeworm. Instead, it is caused by ingesting the eggs of a tapeworm. And these eggs are protected by a pouch so the acid in the stomach doesn't affect them. They hook onto the intestinal lining, hatch, and burrow through into the blood. From there, they are able to affect any tissues in the body, including muscles, organs, and the brain. The picture off to the side kind of shows the life cycle of a tapeworm and how it becomes cysticercosis. So we have our human that eats the undercooked pork that contains the baby tapeworm. This tapeworm then grows into an adult tapeworm in the intestines, and the eggs will leave the body in their stool. So this can go one of 2 ways. This person could actually infect themselves. If they were to use the bathroom and not wash their hands and then ingest the egg, they would turn around and have both tapeworm and cysticercosis. However, if our pig over here were to come by and ingest these eggs while scavenging for food, he now becomes infected with cysticercosis, and now he's going to get chopped up and fed to humans. And if you eat this pig that's been infected, then you're going to eat these eggs and you'll become infected. So now that they're in your blood and they're infecting the tissues, what happens now? So they form cysts in the tissues called granulomas, and they calcify over time due to the body's immune system response to trying to create antibodies that will kill the parasite, causing lymphocytes and eosinophils to build up. So, and this is ultimately going to damage the organ. Up in the top corner, this is going to be cysticercosis in the heart. We also show it in the eye, and then it can get into the brain. Some risk factors include consuming raw or undercooked food, living in or traveling abroad, visiting a farm, close contact with someone who is infected with tapeworm. This just is because you need to wash your hands. You could accidentally ingest these by having contact with someone that has tapeworm. And then drinking from streams and just downright bad hygiene. About 2.7 million people worldwide have cysticercosis. It's not very common in the United States, but it can happen if you were to travel abroad and contract the disease. That said, the rates of infection in the U.S. and Canada are on the rise, with around 5,000 cases reported in recent years. But the highest rates of infection are found in developing countries that have poor sanitation, high rates of poverty, or free-roaming pigs such as Asia and Africa, or Latin America. And then once established in a population, both tapeworm and cysticercosis can spread quickly, and they're hard to control due to the durability of the larva and the fact that just one tapeworm can infect multiple people. So signs and symptoms will vary depending on which tissues the parasites are infecting. In the nervous system, which includes the spinal cord and commonly the brain, it can cause flu-like symptoms, headaches, nausea, difficulty balancing, and in some cases, seizures. It can also infect the different muscles in your body and cause inflammation and pain, and sometimes the lumps can be felt under the skin. And then in the eyes, you'll feel firm nodules, sebaceous cyst, blurry vision, or sometimes complete loss of vision, and inflammation of the iris. Going off of Kevin's symptoms, we can suspect that cysticercosis is affecting his nervous system. So from there, we need to assess it. We can do a physical exam because you can see signs of it, such as in the picture in the eye in the beginning of the presentation, or sometimes you can see those nodules under the skin. You'll want to ask the patient about their risk factors. Have you traveled to another country? Have you done this? Have you done that? And then imaging, you can do an MRI, CT, sometimes an X-ray. You can see the nodules or the cyst in the muscles, but most of the time an MRI is going to be done. If it is suspected to be in the nervous system, you can do a lumbar puncture, or you can also do biopsy, eye exam, or exam of the patient feces. So let's look at Kevin's chart. We already know his history and his symptoms, so we did some imaging of his brain. And here we can see that he does have some cysts, and the two up top that are a little bit darker. This is going to show us that these are alive. And then the lighter one at the bottom is going to show a calcified cyst, suggesting that it's dead. So to confirm our diagnosis, we're going to hop on over, and we can see that Kevin tested positive for our cysticercosis antibody, just confirming our diagnosis. So now that we know Kevin has cysticercosis, what are we going to do? The treatments also vary case by case depending on location and number of cysts shown. Just a simple anti-inflammatory can be used along with a anti-parasitic medication that's designed to incapacitate and kill the parasites. We can also use surgery if it's necessary. And sometimes if the cysticercosis is affecting the brain, it can cause the patient to suffer from seizures. So we could use an anticonvulsant or anti-seizure medication. From here, I would think we could start Kevin on the anti-parasitic medication, and then after further exam, that would tell us if he needs surgery or not.